In this video, we will be covering newly added information for the patient demographics in the TrackNet application. TrackNet has updated patient demographics to include several additional items. To view and set those additional items, first search for the patient to update the demographics for. Next, click the Demographics button. Here, we will look at those items added to the patient's demographics. The first item added is a previous name. Practices are now able to add a previous name for patients. Next is the addition of the mother's maiden name. Both the previous name and mother's maiden name are text fields and can be typed in. Next is the multiple birth indicator. This consists of two lines. The first line is a true or false indicator indicating if the patient was part of a multiple birth. The second line, birth order, is used to indicate what order the patient was at birth. The next field we updated is the sex field. This has been updated to include unknown, and additional information has been added in for sexual orientation and gender identity. To add the patient's sexual orientation, click the box with the three dots on the right of the text field, and a pop-up will appear. On the sexual orientation pop-up, select the appropriate choice. When Other is selected, there's a second sexual orientation line to add values not included in the selection window. To add the patient's gender identity, click the box with the three dots in the right of the text field. On the gender identity pop-up, select All that apply. Gender identity also has a second line to add values not included in the selection window. Finally, we have also made changes to the ethnicity, language, and race. These have been extended to include additional, more specific items, and each can be selected by clicking the small box with the three dots, and then on the resulting pop-up, check off All that apply, and click Save. This concludes our video on the updates to patient demographic information. Please refer to the description of this video for a link to the written guide of these additional items.